Hello everyone, my name is Jerry Jaller. I'm an RN and I'll be talking to you today about coronary artery disease. I know we all know of someone that have had a chest pain, who have had heart attack, going through under treatment or have been through treatments in our life. According to the American Heart Association, it estimates that someone in the US has a heart attack about every 40 seconds, and it affects 16.5 million Americans every year. Coronary artery disease is the damage or disease in the heart, major blood vessels, that is usually caused by the buildup of plaque. This is that it buildup of plaque, that is atherosclerosis. This causes coronary arteries to narrow, limit blood flow to the heart. Coronary artery disease can range from no symptoms, you can feel fine, but then having plaque building up in your heart to where you will have a full-blown chest pain or heart attack. Treatments include lifestyle changes, medications, angioplasty, and surgery. I'll be sharing my screen here to just show a audio model of the pathophysiology of how coronary artery disease work in the heart. So I hope this is clear for everybody. So this is just shows us coronary artery disease and how it can damage or disease the coronary arteries, often due to a buildup of cholesterol, which is the atherosclerosis containing plaques, or as a result of inflammation. On this end here, we can see how the plaque forms in the lining of the artery. It starts gradually and then builds up to where it damages the artery. Damages the artery, the lining of the artery. Eventually, when it builds up, it ruptures, and then our natural body reacts to it by forming platelets that to repair the artery. And then when the platelets join with the plaque, that's when it blocks the artery, leading to heart attack. And on this area here, we can see how the plaque builds up on the side where it narrows the artery and restricts blood flow to the heart. And this end down here shows the platelets and the plaque rupturing, and just this one actually shows a total blockage. So when one experiences this kind of problem, usually you will have a chest pain. A total blockage would be an NSTEMI, like a full-blown chest pain, where you will have EKG changes and your cardiac enzymes will go higher, that is your troponin or CKMB, that will go high. And when it's just like a narrowing, which is a little, I wouldn't call it a little, but just changes to your artery that could include, based on the early signs of coronary artery disease, which will be frequently feeling fatigue, not being able to exercise as long or as hard as usual, and being short of breath even after mild exertion, such as taking a short walk or going up a flight of stairs. If you notice any of these signs, make an appointment to see your healthcare provider for an evaluation, and hopefully they'll put you on some medication or recommend lifestyle changes that would help. Some of the symptoms that require immediate medical attention include pain, pressure or tightness in your chest, sudden shoulder, arm, neck, jaw pain. It presents differently with every individual, and it's different for men and women too. So it could be shortness of breath, extreme fatigue without exertion. In women in particular, typical symptoms could be nausea, vomiting, fatigue, shortness of breath, and back or upper abdominal pain. So we have many major factors that raise your risk of coronary artery disease, and these are the non-modifiable that just we fall into that happens mostly, it is family history. So the risk tends to be higher if your father or your brother, on like the male, usually are at highest risk of having coronary artery disease. And that includes your risk if you have that family member before the age of 55 who had a heart attack or is having problems with coronary artery disease. And on the other end, if you have a mom or a sister that develops it before age 65. And other risk factors include, or let me go back to the non-modifiable. The non-modifiable can include can include race. Yes, it could include race, which many African American male mostly are highly affected by this, or many Mexican Americans. So that is just that we cannot change, and we just fall into it. But with we can modify this order that I'm going to be focusing more changes that can cause the risk factors of coronary artery disease. So things like smoking, uncontrolled high blood pressure, physical activity, overweight, uncontrolled stress or anger, and unhealthy diet. I'm going to talk briefly about exercise and diet mostly, particularly what we can do and change in our life so we can avoid having the problem of coronary artery disease. So to help control your weight, eat a healthy diet, avoid fried fatty foods, and minimize excess sugar and limit alcohol. Focus on eating vegetables and fruits, lean meats, whole grains. Be mindful of your portion sizes and watch your calorie intake. In general, most healthy women need about 2,000 calories a day to maintain their weight, and men needs about 2,500 calories a day. Not only does this type of diet help with weight management, it decreases the likelihood to build up leg in your arteries. You also should exercise, which exercise that is recommended would be a week, 150 minutes a week of moderate physical activity. It doesn't have to be going to the gym. You can take walks around your block, around your neighborhood. It can take about 30 minutes of your day or so that you can walk around, or watch some YouTube videos that use some little exercises that can help experience to reap the benefits of your exercise. Just do something that would help increase your heart rate and keeps you healthy. So yeah, just taking walks for about 30 minutes most days of the week. And another important way to protect yourself from coronary disease is not to smoke. People who smoke have a significantly high risk of developing heart disease than those who do not smoke. Smoking not only affects smokers, but it affects the people around them too. So you can get secondhand smoking. It's bad as it is with first-hand smoking. And also, regular exposure to secondhand smoking also raises the risk of your coronary artery disease. So if you have a health condition to managing your diabetes, blood pressure, and stress too that I talked about earlier, just managing your stress, it is important to keep that condition well controlled, follow your care plan closely, reach out to a doctor, or for stress, you can have a therapist, counselor, or a family member that you can talk to, just someone that can help you de-stress, or you can do some activities that can help you too. For hypertension and diabetes, you can take your medications as prescribed and report any concerns or symptoms right away to your doctor. So thank you for listening. I hope this helps to give an idea of how we can prevent coronary artery disease and stay healthy. I will leave you with a code, beat the heart disease and feel the healthy beat. And I hope you enjoy this lecture, and thank you for listening again, and enjoy the rest of your day.